Hello and welcome to this episode of the Health and Wellness Podcast, a collaboration between Woman This Month and Alkem Health and Wellness Centre. Today I have the absolute pleasure of being joined by Dr. Paulo Hypacio. He is the consultant plastic surgeon and medical director at Alkem. So I think the best place to start would be the philosophy of beauty, what beauty actually is. So in the modern world where we see people through the lens of filters, things like this, how do you, in your opinion, define natural beauty?
It's a very important thing because beauty, the idea, the concept about beauty change in the ages. Now we are living a moment where they speak more about to look natural. And what is to look natural is when the patient recognizes themselves, when we don't change, when we don't create different aspects that goes against, first of all, who they are, from where they come. They just look better, you know, more refreshed, a little bit younger, yes, but still the same.
Yeah. I imagine natural beauty is something that's almost impossible to define because maybe in your native Brazil, one idea of natural beauty is very different to something in the Middle East, and then different to Europe, different to Africa, for example.
Yes. So that's it's actually a very important thing because sometimes I receive patients who ask, Doctor, what I need. It's not about me, it's about the patient. And then we can create something to match with what they want because everything is about the patient, not about me. I cannot impose a way. So that's why we have to be careful about trendy procedures because some trendy procedures cannot match, cannot be suitable for that patient, that culture, that, idea, the concept of a patient, So we have to address the patient according what they want.
It'd be good for us now to sort of discuss the evolution of aesthetics over the years. So perhaps how have patients' ideas towards aesthetic treatments that they want changed from perhaps when you started at medical school through to 2025 and beyond?
In these 20 years, changed a lot. Because in the past, most of patients, they want to change. They want to look or different. Now they are looking more for enhancement, improvement, So today is more important to age well than to look different. So with procedures, we can make something to prevent problems. So the most common example is about the Botox. We know that the Botox can treat the wrinkles, the lines, but we have the lines that are more deep and some lines are more superficial. But if we start to do more earlier, let's say like this, we will prevent the deep lines. Everything is better to prevent than to treat. Right. So cancer, diabetes, blood hypertension is better to prevent than to treat. With aesthetic, it's the same.
Obviously, it's very different ways of treating, but how does that philosophy and mindset transfer to aesthetics? How do you prevent someone growing old? You know what I mean? Things like that.
Great, it's a good question. If I can give one message about prevention regarding aesthetic, it's about to use sunscreen. So the sunscreen, especially, yes.
That's a message for me, by the way.
Especially here in the Middle East, if we work together, because in the past, we as a doctor, we used to focus. So if I would treat your skin, I will just think about your skin. But your skin is related with your gut, what you drink, your kidney, your liver. So we have to treat the patient as something very integrated.
How do you think there are ways of maybe sort of promoting looking after yourself better, but in a way that translates to younger people?
Education.
Okay.
So we have to start with educate the kids since from the school. We don't need to speak about aesthetic in the schools, but in the moment that you are speaking about healthy life habits, they will understand slowly. And it changed for generation to generation. See, our generation, I'm a little bit older than you, but in my generation, when we go to the beach, our focus is to get tan as much as possible. Now they know already that is not good. So you can see the kids, they are looking for sunscreen. There's a specific sunscreen for kids.
They're not just looking for carrot oil anymore.
No.
Just moved on to actual SPF. Okay.
Yeah, exactly.
Okay, that's interesting. So what do you think is a current beauty trend that really concerns you?
Actually, when they cross the natural line, we have to understand that we have an anatomy. Each one has a different anatomy. So when we want to change our anatomy, that's the risk, So unfortunately, there are so many procedures that can, if you don't use in the proper way, you can cross this border. And then there is no point of return. But if you use, no matter which procedure is in the right way, as is indicated, you will not have a problem. So for example, one very common procedure is the fillers that we can do for cheeks, lips, or under eye, If you do in the right way, in the right place, with the right amount, you will be good. The problem when you overdo, when you overfill, and every time you change the anatomy one by one, then in some sort of moment, no point of return. And
You end up chasing natural beauty so long it becomes unnatural.
yes.
Yeah,
So for example, Botox. Botox was created to treat some neurological disorder. And then we realized that works for wrinkles, but we didn't know how to use, we as a doctor in general, and we overuse it.
Okay.
And we had bad results, like frozen results, and create some bad reputation in the beginning. But now we know better how to use, how to achieve the best result without wrinkles, removing the wrinkles actually, but still keeping the natural look.
What do you think's led the change? Because do you think it's sort of the kind of, I guess you call it the body positivity movement? Because I mean, 20 years ago, 80s, 90s, all the models were stick thin or like unrealistic almost looking, and now you have people, embracing natural looks, embracing curves, things like that. Do you actually think that's having a good effect on people in terms of not overdoing the
Procedure.
treatments and stuff?
It's good to have something natural, but sometimes they cross the borders a little bit. So for example, we have to understand about the obesity. Obesity is considered as a disease. If you go to International Code of Disease, there is one code there for obesity.
When someone comes in wanting to fix something, what's your job then? What's your first reaction to that usually?
It's first is about why, not what. So in the moment that we can understand the patient, we will see what is more suitable. I used to say that surgery shall be the last option. Sometimes it's the only option.
Can you give me an example of a particular thing in your experience where someone was pushing you and you said no?
I will tell you the most common thing is when the patient wants to do some surgery, like some body contour surgery, and they are not in the right weight. There is one thing called BMI, that is the relation between the height and weight, So it's proven already when the BMI is over than 30, the patient can have more than 12 times more risk than a patient who are under 30. That's why the doctor needs to be very careful to indicate in the right moment to do the surgery. Because if we do a surgery just because we want to take the money and the patient have some complication, that can be like lethal complication.
You'll lose a lot more money in court than you would getting paid for
Also,
the treatment. Yeah.
and imagine the patient.
Yeah, exactly.
Yeah.
But that's where you as a doctor, I guess, have to stand firm, because say someone was 31, just over, and you think some doctor might be like, yeah, okay, 30, we can get away with this, let's do it. But then, lo and behold, something happens, and then you've lost your career, and you're thinking, for one BMI, was it worth it? And that's I guess where you've got to stay with your convictions as a doctor, and you have to have faith in your own judgment as well.
But this one, it's important to say that, because also we have to understand from the patient's point of view that there is no surgery without risk. Yeah. Even if the doctor follow the guidelines about the weight during the surgery. If the patients follow all the instructions after surgery, still has a risk, and sometimes it's not the patient's fault, it's not the doctor's fault, it's because it's the procedure by itself that there is some risks, and we have to understand that.
How important is the mental side of being ready for surgery as well?
There is one thing called body dysmorphia, what it is. They cannot recognize in the mirror as they look, or they look that they are bigger or they are thinner that they really are. So we have to understand this one, to recognize. Of course, as a plastic surgeon, we will not treat them, but we shall recognize, you know. That's why sometimes I say that we are not only plastic surgery, we have something of psychologists or psychiatrists that we can recognize this one. And for the good of the patient, it's better to treat this one before, because maybe they will go for a surgery that can bring some problem, risk, complications, or whatever, but will not fix what they are thinking that we can fix, you know?
So moving on to our discussion on the art of subtlety. So the first thing I want to ask is basically, what is the difference between work that looks good and refined, or just the surgery that's done?
When we can see some change, I mean, the patient looks good, but no one can recognize that they did some procedure. They just look well, you know? It's really good when the patient comes to us and they start to talk about themselves, like not physically speaking, you know what I mean? How their lives improve, that they're feeling more confident than, oh, I like my, I don't know, my nose, how it looks. No, no. So this one is a good result when we can see that there's a difference and we cannot point what it is.
One word that you've said many times already during this podcast is anatomy.
Anatomy.
Obviously, it's a hugely important part of what you do. But how do you use anatomy and proportion to sort of frame the work that you do?
We always heard about the gold ratio, right? It's really good. It's important. Of course, we can use this one as some things to understand. But we have to understand that the human being is totally different. Each one is different, you know. And then we can use the anatomy to know where to inject. For example, if we are talking about filler or even Botox, with what the patient have, we can create this proportional. So the most important is about each individual in a different way. You cannot create like one size fits all.
You can't just go by ratios in a textbook like that.
No, no, no.
That's part of your...
Plastic surgery, we can mix something like, if we get the ball, we can throw science and art, you know, and psychology. So with this, we can mix all of them, and we will take one plastic surgeon, you know, because we have to understand about art. We need to understand about ratio. We need to understand about math, because some surgery we cannot, we have to use geometry, but we have to understand the person, the people, the human being.
Obviously, a doctor as experienced as yourself, it's not just the procedure's done, thank you, bye-bye. It's a 5-year, 10-year aftercare plan, follow-up.
When we do the follow-up of patient after a non-surgical procedure, this kind of follow-up and, let's say, result expiration is shorter. Botox, 4 to 6 months. Filler can be 6, depends, 12 months, you know? So these patients, we need to see them more often, and we need to explain them about the short duration. When we do a surgery, the patient needs to change their lifestyle, life habits to get a long-term result. You know, so for those patients who are struggle after pregnancies, multiple pregnancies, and then we can do a tummy tuck, for example. They need to follow good life habits. And for example, I have one patient that after the liposuction that I did on her, her mindset changed, that she started to work out, that now she's in her 38s, that she looks better than she was 28, 25, you know?
That's hope for all of us in our 30s now.
Yes, but I have other patients that they had the opposite. Like, it's not about they lost the result, but they put the surgery as a thing that we can do anytime. So it was, I have one very easy example that I did her surgery, and after 3 months, I asked her, "Did you start to work out?" And she said, "No, why I have to work out?" It was like, at least to maintain the result. If I lose this result, I will do another surgery.
The problem is there'll always be one who didn't follow your advice, but they were okay. By luck or chance, for example, they had liposuction and then had a bad diet, but they were okay.
The patient wants to hide that they did some procedures,
Right.
and the old life habits it's still there, and they want to hide from the friends, and the friend doesn't support.
Yeah. All right, let's shift to talking about confidence in care. So a lot of people watching this podcast might be thinking, I thought I was going to have a surgery now, I'm in two minds, or I'm worried, or all these risks and that. But obviously, you are in very good hands with Dr. Paulo, trust me.
Thank you.
When do you see the moment where patients, you see the confidence in their face, sort of after surgery? When do you feel, it's been a success? How long do you need perhaps after a surgery to know that, okay, it was a success?
When they are happy, they don't talk about the result.
Yeah.
They talk about themselves, because when they are worried about something, they will talk about the belly, they will talk about the breast, they will talk about the face, the neck, whatever. But when they start to talk about them, the whole person, not only areas, you see that you did a good job.
Or even in a social setting, when they're sat, they don't want to show any rolls, or they're so conscious about how they look, but then they can just be relaxed and chatting.
Exactly. Because sometimes for example, it's very common for breast surgery that they assume a posture to try to hide themselves, they cross their arms trying to help. And then after the surgery, they feel more confident, Yes, they want to show.
Yeah, exactly.
Especially regarding the breast hypertrophy, they said, "Oh, I'm struggling because I have back pain due my breast." Actually, it's not due the breast directly. It's because they assume a posture that can harm their back. I know, but I did the surgery. Now I'm much better. Why you're better? Because you fix your posture. You're looking more confident.
Yeah, exactly. Yeah.
So no more back pain.
Another thing I want to ask as well is we're talking about aesthetics in the modern world, but the modern world is a broad topic. But if you think of the here and now, even compared to when you started, 20 years ago, if you think of especially in the last few years, things like AI, how do they actually have any influence on what you're doing?
We had a meeting a few weeks ago that we have a discussion about AI, how AI can interfere or help us in this field. And there is one very common concern everywhere, not only about doctors, is if the AI will be like replace the human being, so we will lose our jobs. I don't think so. Actually, I have the same thought that my colleagues, that maybe the doctors who doesn't use technology like AI will be replaced. But AI can be a very good tool to use to help us, okay, to be more precise. But the AI will not replace us, especially when we are talking about beauty. The way that the medicine changed in the past maybe 40 years, we will have the same in 5 years, the same change, the same jump. Everything is changing very fast. But the patient, especially the patients, they have to understand that our knowledge, it's much more than the AI, than Google or whatever.
Well, that was going to be my next point. These days people ask Google, or as we talk about AI, ChatGPT. So you have a patient wants Botox, for example, or it could be anything. Doesn't necessarily have to be a specific treatment, but ChatGPT, hey, what are the benefits? No one wants to Google the negatives. Everyone wants to, what's the benefits of Botox? And then they say, oh, it can give you this, and then they come to you and say,
I want this.
Yeah, I want this. Print it, or ChatGPT, they want this, and then they find it harder to trust you because they're too trusting of AI these days. But you've done 10 years more medical school. I mean,
yes,
your history.
How it works, the technology, Google or ChatGPT, they are fed by informations from everywhere. The doctor can separate. It's good when the patient comes to us more educated, because the ChatGPT, the Google can educate the patient, but also it can create very high expectations about the result. The most important is because I appreciate this opportunity to try to educate more the patients, to understand how it works, and to do the right thing.
Doctor, this has been a very insightful chat. Thank you so much for joining us on the podcast.
Thank you for having me here.
This has been the Health and Wellness Podcast, a collaboration between Woman This Month and Alkem Health and Wellness Centre. Thank you very much for watching, and stay tuned for the next episode.